Hello and welcome. I'm Vincent Makori. This is Africa 54. Now, we'll have those stories in a moment. But first, the West Africa Ebola outbreak is the worst in history. Over 960 people have died due to the deadly virus. The hardest hit countries are Liberia, Guinea and Sierra Leone. But today, Nigeria's Minister of Health confirmed 10 cases of the dreaded disease in Lagos. All were people who had primary contact with Patrick Sawyer, who collapsed on arrival at Lagos Airport on July the 25th and later died.
As of today, 177 primary and secondary contacts of the index case have been placed under surveillance or isolation. 9 developed Ebola virus disease, bringing the total number of cases in Nigeria to 10. Of these 10, 2 have died, that is, the Liberian American and the Nigerian nurse, while 8 are alive and currently on treatment.
Well, the disease is overpowering the health systems of the hardest hit states. Nigeria faces the added problem that public doctors are on strike over pay and working conditions and have resisted calls by the government to end their strike to tackle the Ebola crisis. Chukwu says that Nigeria is now looking to other countries for help in dealing with the outbreak.
Nigeria is actually, as of now, reaching out to various laboratories, various governments, including the U.S. state governments, to see how some of these untried but drugs and vaccines that seem to hold out some hope could also be deployed in Nigeria. We're in touch, and it's possible that very soon we'll probably go the same way.
Well, the Nigerian Red Cross says it has provided 18 volunteers to work with the authorities to educate people on how Ebola is spread. Over the weekend, Guinea announced that it was closing its borders with Liberia and Sierra Leone. Together, the 3 countries have lost nearly 1,000 lives to the disease. In Liberia, where 300 people have died of Ebola, healthcare workers exposed daily to Ebola patients demonstrated on Saturday for better pay and improved working conditions. Liberian President Ellen Johnson Sirleaf promised to settle the pay dispute.
Pay that I promise you for next week, I will make sure that that happens. The other things regarding the insurance, the extra pay, and all of that, we need a few more days to be able to work on it.
Well, Ebola has no known cure or vaccine, but Liberia's government has started discussions with the U.S. National Institutes of Health to see about obtaining some of the experimental medicine that seems to be helping 2 American health workers who contracted Ebola in Liberia. Burkina Faso is the latest West African nation to announce strict airport health checks and border controls to protect itself from the spread of Ebola. A new Ebola center is opened and tougher health checks are now in place at the international airport in Ouagadougou. The airport tightened its health checks in a bid to stem any new cases from entering the country from Liberia, Sierra Leone, Guinea or Nigeria. A Burkina Faso regional health director says the nation is now equipped to swiftly deal with any potential cases.
Once a patient gets here, there is a medical team that works 24 hours a day to receive suspected cases and directly deal with the patients in observation rooms. There are rooms for 1 patient, 2 patients, but also 4 patients. So all the team is ready to receive all suspected cases that may arrive here.
Well, meanwhile, in Senegal, which borders Guinea to the north, a man has been isolated in the northern region of Matam while Ebola tests are being conducted, according to Algeria Press Services.